Hi, all. Thanks so much for joining us on Speaking of Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our amazing interview with Dr. Larry McEvoy, who is the author of, it's a long name, so I'm going to look down, Epidemic Leadership, How to Lead Infectiously in the Era of Big Problems. And that conversation probably could have gone on for another 45 or 50 minutes, but we cut it off and tried to capture the highlights. But he just has so many amazing ideas. And some of the things I wrote down, I loved that he was talking about how epidemic leadership is comparable to coronavirus, but not in a negative way. The coronavirus, he said, is very clear on what it's doing. As long as the conditions are right, it can thrive. And so he was talking about epidemic leadership and approaching it in the way of a pathogen working, and to go out there and, I'm not describing it well. Larry says it so eloquently, but really just going out there and having it be an infectious, positive force. And the one thing that he said that really resonated with me, that it's not the station, it's the approach, meaning that anybody can do this. Anybody can use epidemic leadership to empower an organization, to change a process, and to just be a really positive force. And he also called it epidemic regeneration, and having the regeneration being the state, the epidemic being the how and the regeneration being the state. And I thought that was really cool too. And he shared so many great experiences, a little bit from about when he was a doctor, but the one that stuck out to me was helping a school in Uganda, going over there and taking them from an approach where they said that they were humble and obedient, changing it to humble, obedient, and creative, which really changed their life. A pour of what stuck out to you.
What a fascinating interview, right, Stephanie? I mean, I think talk about big thinker, big solutions for big problems. It's really what the world needs, and I think that's exactly what Larry's providing. What he's seeing is a world in which there's unfortunately a lot of very negative epidemics that are going on. And you can talk about a number of them, including the coronavirus itself. You can talk about mental health issues or burnout, substance abuse. There's so many negative things going on. And he's bringing lessons from the world of biology, adaptive leadership, complexity science into the world of leadership, and making us think about, well, this is how nature would address these problems. How can we as humans understand how can we look at our world differently and think about redesigning it so that it actually generates more positivity? Essentially, that's the essence of, I think, what he's getting at, is that we all have the ability, as you said, Stephanie. We can decide as individuals whether we generate the negativity or we generate the positivity. And if we generate the positivity, that can spread. That can become epidemic. That can not only spread within us and cause healing for us and regeneration, but then it becomes infectious, to others. And ultimately, it starts with how are we approaching the scenarios? How are we thinking about how to approach the world, and what are we bringing into the world? So I think that his message is one of hope and renewal. I think it's a very practical message, as like you said about the Uganda, school, where even school children in a very impoverished community could somehow learn how to change their environment simply by thinking differently. So very fascinating. He's done the same in many healthcare settings, and I find his work to be really uplifting. And I think it's going to be enlightening to our audience.
I think uplifting and empowering are two of the really great ways to describe the work that he's doing. Because as you said, in the medical situations, you felt uplifted. In the Uganda school situation that he talked about, it really took on a life of its own. He went back over a series of years, and to see the growth that he did over that time and how it took on a life of its own was really inspiring. And it's part of that when he was talking about how if somebody's working so hard, so many of these health systems are working really hard, and the providers are working hard to try to do the right thing and check all the boxes and follow the processes to make these change and to meet goals. But he was saying when you know that you're onto something when it's an epidemic situation, a positive epidemic situation, because it feels uplifting and empowering, not like you're running a race and you're tired. And he
Mm.
said, coronavirus isn't tired. All the physicians on the front line are tired because they're trying to treat this, but coronavirus can just keep going because the conditions are right. And positive change can thrive when those conditions are right.
How do you create that dynamic is the main point, because we all know we
We
can
have to
all
read Larry's book.
yeah, there you go. Exactly. A nice plug for his book. We all know that we work in situations that tire us out, and at the same time, we can be in very harsh situations that make us feel empowered. And I think it's studying those situations and understanding how do we build in that resilience, how do we build in the vitality. Those are the key elements that he was talking about that really can be engineered if we take some time to analyze what's going on. Really get to the root cause of what is the problem. That's what he was talking about, is getting to the core of the issue so that we can then figure out what is the real pathogen and then how do we re-engineer it. So fascinating story, probably capped off by, I guess, no pun intended, by the story he told at the end of how once on one of his trips to Uganda, he had noticed that the children were just throwing bottle caps on the floors. And he just went around as he was talking to them, picking up the bottle caps. And the next time he heard from one of his colleagues that school had observed that behavior, and now it was spick and span and nobody threw anything anywhere. What a great example of epidemic leadership in action, right, from Larry McEvoy. So wonderful story, and I hope our viewers will tune in and catch the full interview.
Absolutely. I agree. And I loved it. I hope you all do stay tuned because it was an amazing interview and you're going to love it. And you're going to want more of Larry and definitely want to buy his book because he's an inspiring guy. So stay tuned for that. And we'll talk to you all soon. Bye bye.
Take care.